Hello, and welcome to this webinar on Japan and South Korea's healthcare market. So my name is Britta Stensson. I'm a program manager for Business Sweden here in Sweden. And with me I have Anna.
Yeah, I'm Anna Liby from Swecare. We're a semi-governmental foundation and we work to promote international collaborations and exports from the Swedish healthcare and life science sectors.
Yes. And we're very happy to organize this webinar together. Yeah. So we will soon turn over to our experts in Japan and South Korea. At the end of the session, there will be a Q&A. So if you have any questions during the session, just post them in the link to the right in Invite People, and then we will read them back to the experts at the end of their presentation. So warm welcome, and let's hand over to you.
Organizing this webinar, and thank you everyone for joining us today. Let us start with the introduction on ourselves. So if I may start with, my name is Bong-Soon Park, Senior Project Manager here in Business Sweden Seoul office. I've been working here since 1998. So this year will be my 25th year. And I've been mostly supporting Swedish healthcare and medtech companies in different consulting services, such as partner search or local sales support, market check, and also market entry strategies, consulting, etc. So I'm very happy being part of this webinar and also present about the Korea healthcare market. And hopefully, I could be your contact window on Korean market for your potential business development in the near future. So please feel free to contact me after this webinar for any further question or any service you need. I would be more than happy to support you here in Korea. So that's all for my side. Magnus, can you take over your introduction?
Yes, hello. Thank you for the introduction, Bong-Soon. Great to be with you. I'm in the Tokyo office. I have Mount Fuji behind me. I have been working for Business Sweden roughly 10 years. I work exclusively in the healthcare sector, meaning medical devices, pharmaceutical companies, biotech, a lot of digital products recently. My background before joining Business Sweden is that I worked for Mölnlycke Healthcare, setting up their business in Japan, starting 2003, and then worked with in sales and marketing at Mölnlycke Healthcare for 7.5 years. So it was very natural for me to focus on this sector when joining Business Sweden. Thank you.
Okay, thank you, Magnus. So today we will walk you through overall healthcare system in Korea and Japan, where you will see some common features as well as some differences in both countries. Then we will dive deeper into each market, Korea and Japan respectively. And then lastly, but most importantly, we will also help you understand better how to enter markets and what are the regulatory requirements and process, etc. We will also briefly introduce about the government subsidized service program offered by Business Sweden for Swedish SMEs for the export market validation. And some success cases we have so far supported for Swedish companies in both markets, Korea and Japan. And as Britta mentioned, at the end of the session, we will have a Q&A session. So please leave your question in the chat, or all questions can be addressed during the Q&A session at the end of the webinar. Okay, so let me first give you an overview about South Korea with the key facts in demography. So as you see, South Korea is located in the center of East Asia, so making it an excellent business hub. Neighboring markets, more than 2 billion customers, And you can also reach out 51 cities with more than 1 million population. And then we have also Korea, home to 52 million population. The area-wise, Korea only 1/5 size of Sweden, like Iceland. And Korea is the 10th largest economy in the world with about $35,000 GDP per capita. And South Korea is a highly urbanized country. So with around 85% population living in urban area. So the largest city, capital Seoul, has over 25 million population, which is almost half of the total population. So making it the second largest the metropolitan area in the world. Therefore, majority of healthcare providers are also concentrated in this Seoul metropolitan area. South Korea is also one of the world's most rapidly aging society. So life expectancy at birth is over 83 years. And a large and growing pensioner population drives high demand for healthcare, which increases the healthcare expenditure almost 9% of GDP share in 2021, which is still lower than the OECD average country, but the increased ratio is higher due to the fast aging and great demand for high quality healthcare service in Korea. Korea is highly advanced in ICT and globally top ranked in the digital competitiveness. So World Bank ranked Korea top 5 for easily doing business for foreign companies. And according to the Bloomberg, Korea is the most innovative country in the world. So this is an overview on the demography, and you can also come to Japan, and Magnus, you can present.
Yes, so Japan is, of course, the world's third largest economy after the US and China. I won't go into very much detail here, but if you can click to show some more contents there, Bong-Song. So population is roughly 125 million, which is more or less the same as the UK and France if you add it up. GDP level around $40,000 per capita is on level with many countries in Western Europe, but somewhat lower than Sweden. Life expectancy very high, slightly higher than Korea. We spend roughly 11% of GDP on healthcare in Japan, which is similar to many countries in Europe, including Sweden. We have very many healthcare providers. We have over 100,000 clinics, and we'll get back to that, which means that access to care is very, very good. Roughly 30% of the people in Japan are over 65. Japan is not quite as digitally advanced as many people imagine. So it's lagging a little bit in that sector, and we'll come back to that. It's a very, very highly urbanized country where the capital city and the urban areas surrounding it form the largest metropolitan area in the world, actually. Okay.
Thank you, Magnus. So as you see now, Japan and South Korea have some similarities in their demographics. So here comes more about aging society. In both countries, Japan has the longest years of life expectancy at 65 in the world. Then it's followed by Korea. However, in 2050, Korea will exceed Japan in the terms of ratio of senior citizen to population, since we will reach over 38% of senior citizen to population 2050. Another common feature both South Korea and Japan in the healthcare system, both country has a large number of hospitals and clinics, which are generally well equipped and staffed by experienced medical professional. As you can see, Korea has the highest amount of hospital beds per population in the world, and followed by Japan. And besides, also Korea has the highest number of doctors' consultation per person in a year, actually considerably higher than any other OECD country, and Japan is also next. I mean, the positive side of this frequent consultation and also highest amount of hospital bed per capita can facilitate a healthy population, and both countries have a mix the public and the private healthcare providers. So patients can choose from wide range of providers. On the other hand, we have also many challenges in this regard, because the fewer doctors per person and also the long waiting time, while quite short amount of time for doctor's consultation, and also the high healthcare expenditure caused by the inpatient care focus. So here, to increase more efficiency, we see that the digitalization and telemedicine are pushed to grow in both countries, and where we see also great business opportunities for Swedish companies.
Yes, so Bong-Sun, you just talked about the very high level of medical consultations both in Japan and Korea, and this is very much reflected in the structure of healthcare providers in the two countries that are quite similar. So we have very many clinics in both countries, roughly 30,000 in Korea and roughly 100,000 in Japan. And those are, of course, the first contact of point of contact for most of the patients. And typically in a residential area in Japan or Korea, you just walk a couple of minutes and you have more or less several clinics at your doorsteps, and you can just walk into that and sit down and get the consultation. And that's, of course, the ease of access is, of course, one reason for having so many medical consultations. Both countries are also characterized, but it's quite easy to access all of the hospitals in this three-tier structure. So the top tier is the advanced general hospitals or university hospitals. In Japan, until recently, you could go there without any referral and didn't get any penalty. Now you get a small penalty if you go directly to the university hospitals, and in Japan, in Korea, that requires a referral. But overall, we have very many hospital providers in both countries, and it's quite a diverse, let's say, population of hospitals in different setups, in different ownerships that we'll get back to. So if we go to next slide, I'll talk a little bit about some common features in Japan and Korea. We touched upon a few of them already. Both countries have what we call universal healthcare coverage, meaning that basically everyone living in Japan and Korea have healthcare coverage that covers most health complications that you can have. And we also have a mix of healthcare providers, private ones, public ones, And for most people, it doesn't really make any difference if the provider is government sector or private sector or run by someone else, because the reimbursement comes from the same healthcare insurance system. World-class medical professionals, of course, though both countries have not that many doctors per capita, and doctors have a very high work load in both countries. There's some degree of US FDA and EU regulatory harmonization in both countries. We'll come back to that later. There are also a few things that stand out that are common for Korea and Japan, but are quite different to other OECD countries. We've already talked about the low birth rate, which is a problem in a lot of OECD countries, but it really stands out in both Japan and Korea, with Japan at 1.3 and South Korea at 0.8. And of course, as you all know, roughly, or actually above 2 is required to maintain a stable population. And this means that both countries have a declining population. There are some good things in terms of healthcare statistics compared with other advanced economies. There's rather low obesity rates. And as I already mentioned before, we have quite few doctors compared with other advanced economies. Roughly, almost only half of the number of doctors per capita compared with Sweden. But the doctors probably have a less administrative workload than in Sweden, and are more supported by support staff like nurses who have take a lot of workload from the shoulders of the doctors. Yes.
Thank you, Magnus. Now let's look into more in depth on the specific Korean healthcare market. So I will go through the overall healthcare market in Korea with more focus on the medtech and also digital health. So in Korea healthcare system, the key regulator for the Korea healthcare system is the Ministry of Health and Welfare. So they are responsible for health planning and also policy making and also policy implementation. And they have very close collaboration. First, the National Health Insurance Service, which are the single payer in Korea, and they manage the national health insurance. When it comes to reimbursement, the HIRA, the Health Insurance Review and Assessment Service, are the key stakeholder, and they reviews all the reimbursement quality and also the fees scheme. And if you have a high healthcare technology and also seeking for higher reimbursement scheme, this NECA is the one who conduct the assessment for high-tech healthcare technology. So these are the key stakeholders in Korea. And this is overview of South Korea health system. As we highlighted earlier, Korea has universal healthcare coverage, meaning that all citizens have access to the medical service from prevent care, primary care, and also specialist care. So as you can see, the government subsidies and also the social insurance taxes, the finance, all this, the insurance, and the national health insurance, as a single payer, they reimburse all the service from the healthcare suppliers. And then Korea, we have also high co-payment ratio by out of pocket from private. So therefore, we have a high private insurance support. So most of like 95% of a household has also the private insurance to complement and supplement to the national health insurance. So if we will look at who finance this all health expenditure, as you see that different portion from voluntary scheme and household out-of-pocket payment, and also the government, the compulsory scheme, taxes and social insurance. As you see, still in Korea, the private spending is higher than any other OECD country. It's almost 35% still. However, as you can see, the healthcare service by the government also expanding gradually. So we expect more and more financing from the government, the compulsory scheme side. So let's look at the overall medical device market in Korea. Korea is the 9th largest medical device market in the world. So as you can see, that total market size of the medical device here in Korea is about $7.3 billion. It has been growing steadily, only minus growth in 2020 because of the negative impact from COVID-19 outbreak. But overall, the increase of local production and also exports. Import is steadily growing as well. And also in Korea, even though high production and we can still highly dependent on import. So totally import value is about $5 billion, which takes about 67% of the total medical device market in Korea. Because the premium tech medical device still rely on the global player like GE, Siemens, Philips, etc. So if we move to the regulatory process in Korea, if we are a medical device provider, this is a whole lifespan of medical device when it comes to regulation requirement in Korea. So you can see in Korea, we have a class 1 to 4, depending on the product feature and also the risk level. For example, class 1 and 2 is the less stringent process, only notify process. But if we comes to number 3 and class 4 is the highest risk, which require very extensive approval process, quite complex. So for the pre-market phase, to start with the QMS conformity assessment, we can also apply for a business license. And if necessary, we also require the clinical, the trial report. These are the pre-market regulatory process for most of the medical device supplier. After all pre-market the regulatory approved, you can also apply for reimbursement. After normal business and distribution in the market, you can also consider post-market requirements. because the GMP, this QMS conformity is only valid for 3 years. So it should be recertified after 3 years. And then you can also managing the labeling, advertising, and also safety management, etc. All these, the regulatory system is managed by the Ministry of Food and Drug Safety here in Korea. The next question is then who can apply for this medical device import license and also the GMP certificate in Korea? For Swedish companies, you have 3 options because only local legal entity can apply for this. So you can think about first the local distributor, or you can buy the service from in-country caretaker, or even you can establish your own local subsidiary. However, depends on your business model and also product. This option has both pros and cons. So if we walk through the local distributor, of course, the pro side is they have already experience in the registration local market, and they can utilize their own infrastructure and also own the in-house RA, QA people. However, for Swedish company, you cannot own a license in the name of your Swedish company name. And then there is some limitation when you want to change later the sales channel. You need to agree with the local distributor for any changes. If you buy service from in-country caretaker, of course, it's more flexible because still you can control this service provider. You can also change some service channel, and you can avoid any complication and conflict. Only negative side is, of course, this extra cost to maintain the license ownership. You need to pay a monthly maintenance service fee. If you establish your own subsidiary, of course, it's very flexible. You can control everything. It's under your name holding. However, it's a lot of investment upfront from the beginning. You have to hire personnel, also the infrastructure and own RA, QA. So all 3 options have both pros and cons. So you have to think and consider which option is the best for you based on your business model and also your product feature. So last, we can also briefly touch upon the digital health in Korea. As we already in the beginning mentioned, Korea is very highly advanced in ICT. Therefore, digitalization is fast growing, and we also expect to be our 3rd most digitally competitive in the world by 2030. As you can see here, the electronic medical record is almost 100% implemented in the top-tier hospitals. Even general hospital have more than 90% totally, electronic medical record implemented. On the other hand, the pharmacy management system, PMS, even though advanced, the top-tier hospital has quite highly implemented, but still it's a little bit behind the other tier of hospital compared to other digital health care area. This is one example. Samsung Medical Center, which got the best score from HIMSS. They got the global top indication from the digital healthcare indicator last year. So not only this is the Samsung Medical Center, they are the top tier. Many other Korean hospitals are highly digitalized and implementing the electronic medical record. This is also a big roadmap initiated by the Korean government. So we call it the My Healthway. This is a health information highway. So this platform will create the standardized medical data set and smart medical environment by the personal healthcare record. So as you see here, the data provider from public healthcare data and also individual hospital medical data, and from the personal health data like wearable device or the telemedical devices, these the health record will be collected in the central common data mode. And this will make it possible for the My Healthway platform using the PHL. So it will create a smart medical environment. So this will be utilized for the personal health data information and also telemedicine. If we talk a little bit more about the telemedicine in Korea, it's not fully regulated yet. It's only temporarily allowed during the pandemic. But this trial, temporary, the telemedicine has changed some perception, some negative perception to the positively. So this will also a very strong area we see the growing in the future. So with this all the government investment and also this highly standardized medical system will also give a big opportunity for Swedish digital healthcare companies. Okay, that's it for Korean market. So
thank you so much, Bong Song. So moving over to Japan, let me share some slides with you to give you a general overview of what Japan has to offer in the medical sector. Looking at the key stakeholders in Japan, the Ministry of Health, Labor and Welfare is the spider in the web. They are the key regulator under the cabinet, which is the government. So they regulate the market by different laws and regulations, but their most important weapon, so to say, is reimbursement, at which they decide on. The other really important and really influential association or organization is the Medical Association, which is the umbrella association for the physicians in Japan. So whenever the ministry needs kind of advice from doctors, they contact the Medical Association. So most of the important decisions on healthcare are under consultation with the doctors, basically. The Ministry of Health, Labor and Welfare also look over, or they are the ones to decide product approvals, but they've outsourced much of the processing of the product, the regulatory process to several third parties, whereas PMDA is the most important. I think I'll leave it with there and go to next slide. And here you see, of course, that Japan is the world's top 3 healthcare markets. You can see that medical expenditures are still increasing, though starting to stabilize. Important to mention here that it's all about reimbursement. Japan is a reimbursed market. The healthcare providers are set up to provide reimbursed healthcare. So in most cases, they are not able to provide non-reimbursed healthcare. On the other hand, the healthcare, the universal healthcare system is very diverse and covers more or less everything in Japan. So there's not much demand for other services. Looking at next slide. We've already talked quite a lot about aging society in both Japan and Korea. The key message in this slide is that if you look at the right-hand chart, you see that the biggest pieces of the pie are the people above 80 and the people above between 60 and 79. They actually account for roughly 80% of the healthcare spendings, which means that you would imagine that healthcare spendings will increase and that it will be very difficult for the government to control the growth as the population continues to grow. Let's have a look at next slide. In Japan, most people I would say in the working ages would be paying 30% of their healthcare cost at the counter at the hospital, and the remaining 70% are paid by insurance, by the insurance companies using insurance premiums. Elderly people pay less. For kids, etc., there are a number of subsidized services, so in most areas you end up spending very little for kids' health. Let's have a look at next slide. So Japan is the second largest medical device market in the world. And as you can see, it's still growing at quite a high rate. And it's, there are a lot of imports in this market. So 64% of the market is imports. The total imports are over $20 billion, so an enormous amount. And if you move back to that slide, just So though Japan has a lot of imports, it also has an important domestic medical device industry. So there are quite a few well-known Japanese medical device companies like Olympus, Terumo, that also sell globally. And you can see that they are also actually growing, but the overseas, the international players are growing faster. And typically, the more advanced products, the high-end products, are the imported products from the US and from Europe. Okay. So Bong-Soon talked a little bit about the regulatory process in Japan, in Korea, and of course Japan also has its own regulatory process. Most of the processing of the regulatory filings are done by a third party called PMDA, but there are also some lower risk products that are processed by notified bodies like BSI. And typically the review of medical device applications is 3 to 12 months in Japan, depending on the risk category, and the processing times are quite stable. You can see here also that most of the products that are filed for product approval in Japan are in the lower risk categories, the generic medical devices. And this is kind of a classic contradiction in the medical device industry. When you enter the market and talk to a doctor, a medical device company wants to present it as innovative and something completely new. But when you meet with the regulatory bodies, you typically want to present your product as something similar to something that is already in the market to get less regulatory scrutiny. Okay, let's have a look at next slide. The regulatory process in Japan also has, you can see it has implications on the distribution and the value chain of medical devices in Japan. So just as in Korea, you cannot, as a Swedish company without a subsidiary, you cannot hold the license directly. You need to have someone that represents you in Japan, and that would be the market authorization holder or a designated market authorization holder. And typically that's a subsidiary, if you have one. It's your distributor, but it could also be another regulatory third party. Then in terms of sales, if you have a distributor, if you even have your own subsidiary, you're not able to do the invoicing directly to the hospitals in Japan. There will be an organization or local companies that are called dealers that handle the invoicing to the hospitals. And it's the same for any hospitals, regardless of ownership, whether they're public hospitals, private hospitals, or any other type of hospitals. And yeah, of course, yes. And we talked a little bit about digitalization before, both in Korea and Japan. So you can say that overall, people traveling to Japan from Europe expect Japan to be very advanced in digitalization. They have associations with Nintendo, Sony, consumer electronics, and so on. And that's true in part. But in the healthcare sector, especially in the administrative part of the healthcare sector, Japan is lagging somewhat. So you still have lots of faxes being sent from hospitals and to hospitals in Japan. If you have a look at the left-hand slide, you see that Japan is not fully converted to electronic medical records, at least not in the primary care sector, the 100,000 clinics. Still, there are quite a few of them that don't have electronic patient records. But you can also see that digitalization is entering a higher growth phase in Japan. And this, of course, is just one example. The government is also putting a lot of focus on introducing a healthcare online portal, where something called the My Number card, which is an insurance card, which an IC chip that you're used to log into the healthcare portal. You can see that the usage of it is growing very quickly in Japan, and that's the key to a lot of online services that you used to have to do in terms of filling out forms in Japan. So overall, Japan is still lagging in terms of digitalization in the healthcare sector, but there's a big conversion to digital services now, which means that there are quite a lot of opportunities for Swedish companies in this area. if your timing is right, I should say. Okay. So that was a short introduction to Japan, and now we will tell you a little bit about what we can offer from Business Sweden to companies that are interested in entering the Japanese and Korean markets.
Yes, thank you, Magnus. So as a next step, of course, hopefully you have a better understanding on the Korea and Japan, the healthcare system, and also hopefully find some business potential opportunity for you. Here, we are supporting Swedish companies to enter the new markets, and we can support wide range of services. We are not going to go through all detail one by one, but for this webinar, we can more highlight on the for the small and medium-sized Swedish healthcare companies to consider the Japan and Korea market to enter. We can provide some guideline since the Business Sweden offer the subsidized hands-on support through the export project. We can start with the global business advisory service, which is actually free of charge up to 15 hours. We can find some key market validation for you with some key question from the Swedish companies. And after export validation, if we see business potential on the market, we can also move to the next step, which is called the export project. That is also 50% subsidized up to 500K SEK value. So the Swedish company can pay only half of them, but can get the project value that much. This export project include more broad and in-depth the market checking from the market potential assessment, also identifying the right customer, also the local partner search, and also we can navigate the what regulation required for your product, etc. So these are the most common services we can offer for the Swedish SMEs in this healthcare field.
Yeah,
Magnus, you can add more.
Yes, so of course the export project is a very versatile tool that is used by a lot of companies looking into both the Korean and Japanese markets. And so it's really the way to go for companies that are seriously considering entering these markets. And one key feature of this is that this is a service that you can use several times. So typically market entry takes a while in these sophisticated markets that are far away from your home country. But you can continue using these services to certain limits over time, and we'll come back to an example how it has been used over time. Yeah, so now to one of those cases, which is Ostesign, which is a surgical implant, a neurosurgical implant, and a company that we have worked for quite a long time in Japan. And bringing this up as an example because they have used the export projects in quite a lot of different areas in the market entry. Looking at this timeline, you could say that it's a terrible market entry because it took so long. But yeah, sometimes market entries take time for advanced products, and for SMEs, typically you cannot focus on do everything at the same time, which means that companies typically need to press the brake sometime and pause and focus on other things. But in this case, we used export projects to get started with the regulatory process in Japan already in 2016 and 17. We also used the export projects to set up an evaluation at the university hospital in Japan. OsDesign and we argued that it would make sense to create an experience among Japanese doctors before launching, and this resulted in 9 surgeries at the university hospital in Japan. And finally, they got regulatory approval in Japan in 2020. Before that, we did a partner search. Now we were already in the Corona era, which meant that unfortunately negotiation took quite a lot of time because OsDesign weren't able to travel to Japan. But finally, they launched the product end of 2021, and we supported the first full year of sales last year. We're continuing to support them this year, selling through a great distributor in Japan.
Okay, thank you. Then I can take one example as a success case in Korea. We're offering the export to project since 2000 till now. So it's almost more than 20 years. We've been supporting this company called Context Vision. They are established in 1983 and also listed in the Oslo Stock Exchange. They're based in Sweden and have their own offices in US, China with their own employee, and Japan also through their local distributor. But in Korea, we Business Sweden supporting local sales, representing Context Vision on Korean market. So, for example, myself been working for this Context Vision more than 20 years, supporting also representing this company in Korean market. So if we look at their sales by country, Korea has been the highest turnover among other markets and other regions. So taking more than 30% of total income from Korea. So our customer very happy. The Context Vision. They also said that you need to understand the local market dynamics to succeed here, and our support locally can also fast responding to the customers, and this is quite critical to be successful on the local market. So hopefully we can also support more companies. I'm also working for other Swedish medical tech company in the local sales support. So it is quite efficient. Also, we can offer the hands-on support locally for as your local representative market. So I think this is from all, but I think Magnus, you have something announced and also present about new.
Thank you so much, Bong-Song. So now we've gone through the Japanese and Korean markets and giving you an introduction. And this, I'd like to introduce you to an activity that we have now during the spring, which is called Nordic Health Summit Japan 2023, which is a partnering and investor conference in Japan, where it's the second year we do this, and where we invite Japanese pharmaceutical companies, medical device companies, financial investors to meet with Nordic SMEs, startups, and partner up with them. And I invite you to consider joining either online, which is possible. That's on the 25th of April. The best way of participating is, however, to travel to Japan and participate physically, where you'll be able to interact, have matchmaking meetings, and socialize with the Japanese companies and other stakeholders face to face at the embassy. We have a web page up and running now where you can sign up. I will hope we can share this in the show notes as well, as they say. Yeah, I think we need to leave a few minutes now for Q&A.
Yes. Thank you. So with that, we conclude our presentation, and hopefully we have some time left for Q&A session.
Yes, thank you, and thank you, Mongsun and Magnus, for your very interesting presentations. It's great to hear that there are so many opportunities for Swedish businesses and Swedish companies in these very exciting markets. So we only have a few minutes left. If you have any questions, please add them to the chat. But to get us started, this is actually a question for both of you. Which areas within healthcare do you see the highest growth in the next 5 years? Mongsun, can you start, please?
Yeah, I mean, as we already mentioned, since very much digitalized moving in the medical healthcare device market, so we see that much growth potential in the digital healthcare, and also the personalized medicine. And also biotech is also very much on the rise. We didn't touch much on the biopharma area, but there still we see the much growth in the Korean market. So overall, this Korean healthcare market is expanding. So we see more, also increasing the healthcare spending. So we believe that the digital healthcare and also the personalized medicine and also preventive medical care, that is more focus on the Korean market in the future.
That's great to hear, and I think it's also great to hear for the people listening, since these are very strong areas for Swedish companies in this field. Magnus, what about Japan? Same question.
Yes, so quite similar. There are great growth opportunities in the companies that can capture the digital shift in Japan that has just started. It's very important there to, understand the timing. The timing is critical to hit it right. If you're too early, you might spend a few years without a lot of growth. But if you can spot that working with us, there's great opportunities. And also, generally speaking, just as Korea, as people age, there's need for more healthcare. So everything that has to do with surgery, for instance, there's a lot of growth opportunities. There are niche areas like infertility treatment that are really important, as Japan is hitting low growth rates. And also, last, but I should mention that Japan has a very big pharmaceutical sector that we haven't talked about that much today. But because of that, there's big growth opportunities for Swedish biotech companies in Japan, as they need to improve their pipelines.
Thank you. We only have about 30 seconds left, but Anna, do you have a last question?
Well, I was actually thinking about when you say digital health, is it health record systems or decision support or remote patient monitoring? Do you have any idea of that?
Yeah, if I may start, all the the IT infrastructure for medical care is facilitated by the government initiative. All this EMR, PHR, also the EHR. I mean, that will also ground, for the in development of the telemedicine also. So we believe that with the both combination of the government support and also the high-tech company solution provider on this digital healthcare will make a much bigger synergy in development of digital health in Korean market.
Okay, thank you.
Yeah, and just maybe a few words about Japan too. I mean, just one example is the digital shift happening now in pathology, where you've seen something similar in the last 10 or 20 years with CTs and other imaging data being digitalized, and this is just starting to happen now in pathology, and this is just an example. And then I think a lot of the administrative systems are kind of difficult because they need to integrate to the local insurance system, but everything that can improve the efficiency of the healthcare and save time for the doctors that unfortunately are becoming fewer and fewer in an aging population. Those services have great opportunities.
Similar issues as in many countries. So that's it for the session today. Thank you, Bonsung, and thank you, Magnus, and thank you for everyone who's been listening. If you have any questions or if you want to get in contact with us, please don't hesitate to reach out. And we just want to say thank you very much.
Yeah, thanks for joining, and thank you for sharing.